Greetings, this is Timothy Youngson, Digital Apothecary. So I want to talk about a article that has been making the rounds on social media and such, and it's basically about how is ChatGPT better than a doctor answering a medical question? And I've seen some interesting takes on this. I've seen people put in like, yeah, no, ChatGPT is better. It provides better answers than a physician. It gives more empathetic responses and such. So let's go through this and like talk about some of this stuff because it really intrigued me when it came out. So it's from Ayers and colleagues. It's called Comparing Physician Artificial Intelligence Chatbot Responses to Patient Questions Posted to a Public Social Media Forum. And it's published in JAMA Internal Medicine, came out now last month in April. And, it's really interesting because with ChatGPT, this is something I use every day currently, and I use it for a lot of different things. And a lot of people are trying to figure out, can we use it in medical and what limit can we? And I think this is where the authors came from. You read their introduction, they note that there's a huge interest in this. So I went through, read the paper, spent a lot of time going through it and the methods and everything. And I really found it interesting. I think, but I think a lot of the takeaway I see people saying it's more accurate, it's better, and such, I think is overstating some things because that's not what the goal of this paper was. It's to spur a conversation. I think it's generating the conversation it's supposed to have. Whether or not that the points I think it was trying to make is going to be used inappropriately, this is where maybe my concern is, and that's what I really want to talk about more. So I'm always more about methodology, so how do they do this? And, if people just scroll through the abstract, I think they're going to miss a lot of key things. A lot of people picked up, oh, it's on Reddit's askdocs, which is a forum. And if you don't go on Reddit, then this may be like, this may be a shortcoming because you may not know like the environment of Reddit in terms of like who uses it, what they talk about and such. So it's almost self-selected in some ways. Interestingly, the researchers have used askdocs in the past. They reference that in the methodology, so they're kind of used to it, and they pull from that. And they publish other papers around this. I think this is the first one that's been made it to JAMA with this methodology, though. So it's interesting from that perspective, but it's definitely something that they have experience getting into. In this case, though, when we look at it, like if I read, what their core objective is that we tested ChatGPT's ability to respond with high quality and empathetic answers to patients' healthcare questions by comparing the chatbot responses with physician responses to questions posted on a public social media forum. So this makes a lot of sense because, you don't have to go through and mine actual patient-related questions through an EHR and everything else. This is going to really co-opt a lot of data around that. This is all publicly facing. The form they're going through, you think is basically screened by the moderators for that you have to be a medical provider providing answers. That's not always the case. You see that they'll delete a lot of stuff that other people will add on comments. But at the end of the day, they chose to, what I find really interesting is only physician responses were studied because we expected that physicians' responses were generally superior to those of other healthcare professionals or laypersons. It's like, okay. So I guess if you're a nurse practitioner, PA, pharmacist, anyone else, you're done. They're just taking MDs. Okay, so or MDs, DOs. Okay, we'll run for that. In any event, they were going to look at 200 questions. They selected 195. And I think the key thing here, though, is they basically took these questions that they selected and the answers that are posed, and then they basically, in my mind, it sounds like they just made a table. Here's a question posed by a user, patient. Here's the answer provided by the providers, and here's ChatGPT's, response. And then they basically had a panel of several of the authors and were on the panel, it looks like, that basically reviewed the responses. And 3 members of a team of licensed healthcare professionals working in pediatrics, geriatrics, internal medicine, oncology, infectious disease, and preventive medicine would then evaluate. And they basically use like a Likert scale analysis, it sounds like. So they were basically challenged with like, which response was better. And, better is very subjective, but, their argument was that this is kind of like just looking at, how does it seem? Accuracy was not assessed here. And I think this is where it's getting overblown, is people saying ChatGPT was better. Better in what way? Empathetic responses, what seemed like a better response, I think is the key thing that stands out here. Accuracy was not assessed, was not looked at. So that I don't want to be overstated, and they recognize that in a limitation that wasn't looked at. So, and I think that really comes back to this because one of the things that stand out to me is, you look at the results, the answers that ChatGPT gave is longer than the traditional answers on askdocs. And I think about this, and one of the things I always come back with Reddit is I always think with Reddit, you have people that have a little bit of time. These are providers that are just going to give a quick quip in terms of what's going on. For all I know, they could be taking a break and just saying, now just run through Reddit. Oh, I'll just give a quick answer here versus, a long answer that you traditionally would see done medically, possibly. So there may be some things going on here. The environment, what was the expectation? None of these people who made these answers would have expected that their answers would be compared against an AI. But from methods, quickness to get this out the door and publish this and make sense. But I think that's something that has to be talked about. So, they basically, the providers looked at and said, which one they like better. And to me, it's like, I look at table one, the type of questions that are posed and the length of the responses. And it's kind of like, yeah, these look like longer responses and they look more well thought out. And that probably looks better. I would expect that. And it seems what the evaluation scores have really done there. And that maybe something that's going on is that, a more well thought out, lengthy answer is good, which I think is why when you look up medical information online, there's a certain length and style that is adopted by many different online health blogs. And I mean, I write these things because that's what people Google and look for at the end of the day. And it's that style that, really makes it to the top that people will find. And I think, for example, if I look at this, like, we go on askdocs, like, here's a question, forced by ER family to Barack Obama was still a president, woke up 2 weeks later with a breathing tube. What will my recovery be like? And they give some information about themselves, history, and what they did and such. And, someone just provides like this response is the top answer right now. And we scroll through and, take it day by day and stuff like that. So, and these deleted are probably from other people that then the moderators and stuff like that will take off. I typed the same thing into ChatGPT and just, voice of a doctor, how would you respond to this issue? And, that's giving a lot longer response. And I like this because you see, as a doctor, I'm sorry to hear about your recent hospitalization. It starts off with that. It starts off with an empathetic response. And you don't see that here, hard to say. Could be this, delirium and such, take it day by day, I'll get aggressive, blah, blah, blah. So I think for me, it's like, it's Reddit chat versus this kind of chat. Is it apples and oranges comparison? Possibly. But this does, even initially seems nicer. Again, I'm not looking at accuracy. It's talking about, medications, things like that. So let's try with a different thing. Let's go back here. Let's find something. I'm not going to choose that. There's always a lot of substances on here. HPP and here. How's this mouth drooping? Looks like it's not good. I mean, it's just the title. I think, we know that something neurological is probably going on, I would guess. Slurry speech and everything else. And first response here needs to go to ER now. And yeah, stroke, ER, that's probably what comes to mind reading that. That's what came to my mind. How you respond to that. People are saying just go to ER. So like, let's type that in. In the voice of a physician, how would you respond to the following? We'll stick that in there. See what it does. As a physician, I'm concerned about the symptoms you're describing in your husband. Droopiness of one side of the mouth, trouble finding words, slurred speech, and difficulty with handwriting could be all signs of stroke. So again, it's getting right to that. But just how it starts is a more empathetic concern that I think is the hook. So that's the stuff that comes out. So does it basically say the same thing? Require immediate medical attention. It goes into detail why in the meantime it's important to keep your husband calm and comfortable. Do not give him medication or food. Please do not hesitate to seek medical attention. I mean, it's not saying, it's basically saying you need medical attention. These guys are just more aggressive with it. I mean, aggressive in terms of like, go to ER now. So do they both get the message across? Probably. Does one seem more empathetic? Yes, but I think that was the goal of this paper, right? Who gives a more empathetic response? And I think it's just the nature of what's being written. So ChatGPT does a pretty good job at that. Accuracy, it wasn't accessed. There's a lot of them that are there, so you can scroll through and just see what you think. But I think for me, the key thing here is that what was the response, what was the style, and everything else, so what stands out. Um, I mean, it works. I mean, I look at this, I think to myself, we could test this many different ways. For instance, I'm an educator, and I can ask myself immediately, top of my head, I have so many samples of graded drug information questions, presentations, um, patient cases, and I've been playing with it. I mean, what stops me from basically doing like a single blind kind of analysis where I just take what's already been done, take the same work, put it into ChatGPT, and just make it and give it to a bunch of faculty and say, hey, who writes a better thing, and see who does better. That's where I'm headed towards these days of wondering these questions, because I don't think it'd be hard to do from that kind of perspective. We have a rubric we follow, so you can follow style, who grades better, who writes better, and such like that. So I think we'll see a lot of these studies come out, this kind of things. I think it's a good conversation point. But coming back to why I want to talk about this is really it boils down to is accuracy. We still have to look through that, and just downstream effect. Does this mean for someone that's looking like, yeah, I'm going to start using this in my process right now? I don't think you would want to. I almost feel like these days what we're heading with AI and such is I always think about a minimum viable product, MVP. I almost wonder if this stuff is turning to a minimal viable answer. So hey, let's just have this do this and let me QA it. Hey, is that answer good? Style good? Yeah. Is it accurate? Yeah. Okay, push it. Send that message to the patient, right? What's the basic answer that we're fine with and we can't agree with? Now, this is giving me stuff for that. Like the one that I saw here that I would like to check is, let's say it was a question about cost. And there's a lot of questions that come through the EHR. Yeah, so let's check this. So we'll go through this for a little bit. So this looks interesting. And where I'm going with this is that, there's a lot of questions come into an EHR from, that a patient could put through, like, my portal, like, I had this, what should I do? But I need to book an appointment. I need this refilled and such. Could this stuff handle it and take off that cognitive labor that the workflow gets chugged with, and that providers don't want to deal with in their staff? Because not everything's gonna be a medically related question in terms of like disease or condition. It's a lot of like coordination of care, I feel like. And can ChatGPT take that on and address it is going to be the key thing. Going further with that, I think that's why the authors were looking at this, is that, can we turn to AI, these types of things, to actually do this work? So in the, what did I say? In the voice of a physician, how would you respond to the following? Let's see what this thing does. Discuss medication costs with this healthcare provider, which is interesting because as a physician, blah, 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 you're talk to the provider, you are the provider. So there it's kind of like, maybe it'll help find more affordable options, such as switching generic medications or finding patient assistance programs by drug manufacturers. Be interesting if eventually just link to it. If I did this, I wonder if I get this a different kind of answer in Google. Unfortunately, Medicare extra help, low-income subsidy programs, ordering medications from other countries by online pharmacies can be risky. Speak with financial counselor, social worker. Hope this information has helped you. Be curious what actually the answer is given here. This one actually, yeah. So Needy Meds is a website that's used a lot for giving like drug coupons, if you can enroll in them and such, like those types of things. I wonder if we get to the point where you could just put data in and just auto enrolls you. That'd be really cool. Especially pharmacy and others might really like that. And so with manufacturers, go to HRSA, funded health center user. So 340B programs. Yeah, that's interesting. Put that there. plus drugs. I don't think this one was listed, was it? Farxiga. Yeah, a couple hundred. That one actually now coming, the SGLT2s that they're trying to bring on. So anyway, looking at this, like definitely interesting response here, very like kind of generic, I would say, here versus this answer. People are actually giving some links or suggestions that stand out to me. Now, which one's more empathetic though? This one, in terms of like actual usable information, I'm looking at this one. I would say here, there's some actually things that stand out to me that I would go through. So there's definitely a difference. And I think that's kind of stuff that would come up to me in terms of like, how to solve some of the issues that are going on and where you would enroll and put the stuff and use at the end of the day. So anyway, sum this all up. I like this paper. I think it's generating the conversations that need to happen. I think that we're going to see more of this stuff come out. And I definitely think like the possibilities are, it's really good at drafting things. And I almost wonder if you'd be on the flip side, it'd be better to just take an answer and just put into ChatGPT and say, make my answer more empathetic. Going the other way, would that be better at the end? I'm not too sure. Actually, let's try that. So what if I went into here, just like, let's turn that. Make this answer to the above more empathetic to the patient. I mean, this is a lot longer, to be quite honest, but reading through this, you can pause if you want. It definitely seems to be a little bit more like narrative focus on the patient. There's things that language in here that might come across better, just the opening, closing, some of the language goes in versus what's here, because this information is good. This, it looked better, and this might stand out for a user and a person like, yeah, this needs much more empathetic. So, we're going one way versus the other. This is maybe what would come out of this kind of stuff. So, yeah, I'm again, it's going to generate the conversation. I think that's needed. I think we'll see this go further. I think for people who are really, holding this thing up and saying, hey, ChatGPT is better than the provider, I don't do that. I don't think that's really what it's supposed to do. But I think it's definitely opening the conversation that we really need to consider how we enroll these types of models and these types of tools into healthcare and what they can mean for us in patient communication, other things that are going on. So I really do value the work that the researchers and authors put into this. I think that's what we need to take away. But yeah, the hype that some people are putting out there, I think is, I hope other people, maybe industry and others that aren't actually reading this thing and just reading the abstract are saying, yeah, this is it. This is the end of the day, because yeah, there's a limitation on some things that the authors acknowledge in terms of where it's coming from, what you're doing. And again, like I could do this and pull answers from the past and compare. I wonder if almost going forward, people are going to be like, hey, people are comparing this AI. Maybe we should put more time into this, and this is going to now bias future answers in the future. I don't know. Be quite curious, or if nothing's going to change the status quo and maybe what it is. I haven't gone through Reddit to see people's response and ask docs and that channel or others, so I don't know their response. I might dig into it one day, but this is just my outlook on here. I mean, it's really cool. And then probably spend some more time this summer myself digging through from a pharmacy standpoint, especially around drug information stuff. I think that's really where I have to ask myself where these types of models, imaging, pill ID and stuff like that is going to go. What's the status for that? Where we're going to break down with all these things and where we can actually use it, I think is going to be very key. So thank you for listening. Leave a comment about your thoughts or where things are going to go. If you see other papers like this, let me know. I really appreciate it, and I'll dig into them. So you take care and have a good day.